Good morning, and thank you for joining us. My name is Karen Curtis, and I am a member of the Provider Outreach and Education team here at WPS. With me today is Tom Ryan. He is going to be helping me out behind the scenes, as well as adding links and additional information in the chat. Now, today is the first webinar in a series that Tom and I plan on holding for topics that are related to Medicare Secondary Payer. We're starting out with ground level concepts, and we're going to build on these concepts to cover different plans, different contractors, and eventually we're going to get to billing Medicare claims and the rules that go along with that. Now, each session is going to have two parts. So the first part is going to consist of a webinar that presents the materials. So that's what you're attending today. I will tell you that during the registration process, we did receive over 150 questions, and we want to do our best to provide you with answers to all of these. So to accomplish this, there's no way we can cover all that information and answer questions in an hour period. So we're going to split these into two different parts. Part two is going to consist of like a short review of the material that was covered in part one. We're going to go over some questions and answers. We're going to have a session for that, and we're going to take time to address pre-submitted questions that were asked during the registration process, and we're also going to get to questions that are entered in the chat. So you'll have an opportunity during that part two to enter questions during the chat that if we have time, we'll get those answered live. So for today, if you do have, if you do enter questions into the chat, Tom is going to answer those that are related to clarification of the material being presented. If it is more than needing clarification, then we do ask that you send that question in an email to our education mailbox. That way we have time to research it and get you an answer. Now, part two for this particular session is scheduled for August 5th from noon to 1 Central Time. Our live events page has a link to register for that event, as well as our next event, which is MSP Group Health Plans. Because we received questions that covered such a variety of topics, we have tried to break those down to kind of fit the different webinars that we have planned. So if you asked a question and it's very specific to, let's say, end-stage renal disease, then that will be something that we'll take and we'll cover when we cover, when we get more specific on end-stage renal disease. So today we're kind of doing an introductory session for overall view of MSP. So Medicare Secondary Payer, the information that we're providing today is for traditional fee-for-service Medicare Parts A and B. This does not apply to Medicare Advantage plans, which is also referred to as Medicare Part C. Medicare Advantage plans are issued by private insurance companies, and their claims are not processed by WPS. So today we want to cover those ground level concepts of the different MSP plans and fundamentals. We're not going to cover billing in this session, but that is something that we will cover in later sessions. Today is about introducing MSP to those who may be new to Medicare or maybe haven't had to deal with MSP situations. This could also be for someone who worked with MSP in the past and just wants a refresher. So in this session, I'm going to define MSP. We're going to look at the different plans and get some overall details on that. And then we'll cover some key concepts. And then at the end, I hope to provide you with some helpful resources that'll kind of guide you through learning more about MSP and Medicare's rules and regulations. So Medicare Secondary Payer means that another entity is responsible for considering charges and possibly making a payment on services that are provided to a patient before a claim is submitted to Medicare. So this other entity could be a private insurance company that provides healthcare coverage for the patient's employer. It could also be an auto insurance or liability insurance for a store or a homeowner. There's just multiple scenarios that could apply. And the primary insurance doesn't necessarily have to make a payment. Maybe there's a deductible or a coinsurance that has to be met before a payment is considered. Maybe the patient has a workers' compensation plan, and the reason that they are being seen isn't related to an injury or an illness that's covered by their plan. These are situations where Medicare will consider making a primary payment based on the specific situation. What are the government's goals when it comes to MSP? The overall goal is to reduce Medicare spending. Medicare Secondary Payer rules were put into place to prevent Medicare from making payment on claims when the responsibility should fall on the patient's primary health insurance. This helps save money for the Medicare Trust Fund. Now, if you're new to Medicare and you aren't familiar with the Medicare Trust Fund, it consists of two federal accounts that are held by the U.S. Treasury, which pay for services received under Part A and Part B. The accounts are funded with payroll taxes, income taxes on Social Security benefits, interest earned, and premiums from individuals who aren't eligible for premium-free Medicare. Now, these savings help extend the life of the Medicare program. So hopefully it'll be available when we retire. Providers can benefit because commercial and employee group health plans usually have payment rates that are higher than Medicare. Finally, following these guidelines can help avoid Medicare recovery of payments. So this occurs when Medicare pays for a claim that should have been covered by another insurance, and it results in Medicare taking their payment back. Now, there are a few types of Medicare secondary payer plans. You're going to commonly hear to these referred to as grouped into either employer group health plans or non-group health plans. I'm going to provide a high-level overview of the different plans that you may be exposed to when dealing with Medicare and other insurances. So we'll start with employer group health plans. These plans are offered through an employer, a union, or an association to individuals while they are still working. Patients could also be covered by their spouse or another individual, such as a legal guardian. Sometimes if a disabled child qualifies for Medicare, so also a primary insurance could pay first depending on their parents' employment status. Working aged refers to individuals who are age 65 and older who have Medicare Part A and are either currently employed with an employer who has 20 or more employees, or they have a spouse of any age who works for an employer who has 20 or more employees. Next is disability insurance. So you may also hear this referred to as a large group health plan. This occurs when an individual is under the age of 65 and they're entitled to Part A Medicare based on a disability. They can be covered by a large group health plan because they are currently working for an employer who has 100 or more employees, or because a family member is employed by a company with 100 or more employees. Now, I mentioned that individuals for these first two plans would be entitled to Medicare Part A, so I want to explain that. Medicare Part A is also called hospital insurance, and it helps pay for care a beneficiary receives in the hospital, skilled nursing home, hospice, and for some home health services. Medicare Part A is free for individuals who have worked and paid Medicare taxes for at least 10 years or are eligible for monthly Social Security or Railroad Retirement Board cash benefits. The last one we have on the group health plan list is end-stage renal disease. This is also called ESRD. An end-stage renal disease is when a person has permanent kidney failure that requires regular dialysis or a kidney transplant. Now, individuals can be eligible for Medicare entitlement regardless of age. Criteria would include having worked the required amount of time under Social Security, railroad retirement benefits, or as a government employee. They would be eligible for Medicare, and or they have a spouse or dependent child of someone who meets these requirements. Now, if a person becomes entitled to Medicare because of ESRD, their group health plan would be primary during a period of 30 months. So you'll hear this referred to as a coordination period. Then when the coordination period ends, then Medicare becomes primary. So that first 30 months, they get entitled to Medicare for ESRD, and their group health plan is going to pay. And then after that, then Medicare becomes primary. So before we move on to the next category, I want to do a real quick recap. So we have working aged is for individuals 65 and older who are entitled to Medicare and are either still working or they have a spouse of any age who is working for an employer with 20 or more employees. Disability is for individuals under the age of 65 who are entitled to Medicare due to a disability, and they are covered by another insurance, typically referred to as a large group health plan, because they or a family member are employed at a company that has 100 or more employees. Then ESRD is for individuals who became entitled to Medicare because of permanent kidney failure that requires regular dialysis or a kidney transplant. And their group health plan is going to be primary for that coordination period, which is 30 months. Now, our next set of insurance plans are non-group health plans. For these plans, determining who pays primary is going to be situational. These types of plans don't cover everything. They're not going to consider payment for services received they are going to consider payment for services received due to a specific accident, illness, or injury. So first on that list, we have liability insurance. And these are plans such as homeowners or automobile liability insurances and malpractice insurance. So payment is based on the policyholder's liability or injury for property damage. I remember a long time ago, I had it explained to me, like if somebody would come over and they'd get injured at your house, then your homeowner's insurance could cover their medical bills. No fault insurance can either be auto or non-auto related. This type of insurance pays for injuries that occurred on the property or premises of the policyholder, regardless of who is at fault. So an example could be if a beneficiary was involved in a car accident, but they were the passenger and they had to be evaluated at the ER. So in that case, the driver or the policyholder could be responsible for their medical bills. Workers' compensation plans require employers to provide benefits and medical care for workers who are injured or ill because of their job. Um, you know, People can get injured on their jobs. A lot of, construction, you hear about that a lot of times in construction. So anything related to that injury is going to be under that workers' compensation plan. Federal Black Lung is a program that provides medical coverage for treatment of lung diseases related to working in coal mines. The condition was originally referred to as coal miner's disease, and it's more common in the central Appalachian states, such as Virginia, West Virginia, and Kentucky. So not really something we see here a lot in the Midwest, but just so that you're aware that that is another non-group health plan insurance that could affect Medicare payment. So, after looking at this list, hopefully it makes sense why determining who pays first is going to be situational. If a doctor's visit is related to an injury that the patient received on the job, then workers' compensation should be billed first. But if that same person goes to the doctor because they're running a fever and they don't feel well, then that claim is going to be submitted to Medicare first. Liability, no fault, and workers' compensation are state-run insurances, while Black Lung is run by the Department of Labor. So there could be differences in those state-run insurances also. Now, here are some other plans that you will likely come across. So let's take a look at these in a little more detail. You may hear Medicare Advantage plans referred to as Part C. These plans are offered by private insurance companies. They usually bundle both Medicare Part A and Part B. A lot of times they're going to throw in prescription drug coverage called Medicare Part D, and sometimes they'll have extra benefits like dental or vision coverage. Well, these plans are also referred to as Medicare replacement plans, and that's because providers must bill the insurance company that offers the plan and not traditional Medicare. Traditional Medicare does not pay secondary to these types of plans. Veterans health plans are handled by the U.S. Department of Veterans Affairs. These plans cover medical and hospital insurance, as well as mental health, dental, and vision. Eligibility is based on basic service and discharge requirements. Medicare does not pay secondary for services that are authorized under the Veterans Health Administration, but they will consider payment for unauthorized services. Medigap is a Medicare supplemental insurance that is issued by private insurance companies. These plans help with the beneficiary's out-of-pocket costs, such as deductibles, copays, and coinsurance. Individuals generally must have Medicare Part A and B in order to purchase a Medigap policy. And finally, we have Medicaid. Medicaid is a little different because it is run by both federal and state agencies. While the federal government has general rules that all Medicaid programs must follow, each state runs its own program. So, what this means is that eligibility requirements and benefits can vary depending on the state issuing the plan. Medicaid policies will always be supplemental to Medicare. So we just covered different plans and how they fit into a person's Medicare coverage. So now we want to cover some key concepts. Now, based on federal law and regulations, providers, physicians, and suppliers who provide services to Medicare beneficiaries have a responsibility of determining who should be the primary payer for the services received. So some ways to do that. First, obtain insurance information at the time services are provided. Now, there are different ways to do this, and we will get into some more details on how to do that in just a minute. Once you've determined who should be paying first, then services should be submitted to that payer. There are multiple responses that can be received from that payer. They could make a payment. The payment could be applied to the patient's deductible or coinsurance if money is still owed, or the primary insurance could reject the claim without making a payment at all. After notification is received from the primary insurer, then you'll want to submit the charges to any additional payers and include information that lets us know how that primary insurance handled the claim. This is something that'll be covered in later sessions when we get to billing and how to bill those services. Now, earlier we talked about plans that are situational. And that is what the last bullet pertains to. If a patient has a workers' comp plan or a liability plan, if the reason for their visit is related to an illness or an injury covered by that plan, then you're going to want to submit those charges to that insurance company before sending it to Medicare. If the visit has nothing to do with the illness or injury listed in those plans, then Medicare is going to be billed first. Now, there are a variety of ways to check who should pay the claim first. When the patient arrives, you can ask them if they have another insurance. CMS does provide sample questions that can be used as an admission questionnaire. Now, you aren't required to use these exact questions, but CMS has done the work for you, so why not use them? Um, the examples provides a series of yes or no questions. It covers each type of insurance plan. If the patient answers yes, then they're going to be asked to provide additional information, such as the name of the insurance carrier, the policy or claim number, excuse me, date of the illness or injury, things like that. So in theory, you would be able to get all the information that you needed for any situation. And when we take a look at resources, I can show you where you can find those questions if that's something that you would like to use. WPS SNAP is the WPS Secure Net Access Portal, or also referred to sometimes they just call it the portal. And providers must register for access, but once you've logged in, you can run eligibility checks on patients to see what other insurance plan a patient has, along with a lot of entitlement dates for those plans. It does provide a lot of other eligibility information, but it is really nice to see those MSP plans. It gives you the name of the company. It'll give you websites. There's really a lot of information there. HETS stands for HIPAA Eligibility Transaction System. This is a product that is provided through CMS that allows users to check Medicare eligibility data in real time. It does involve the transfer of electronic files, so your office or facility would need to be set up for that. Most likely you are, because the majority of our claims are received through electronic transmission. Now, if you are a provider who uses billing agencies or clearinghouses, you can obtain eligibility information from them. And then the last option on the list is direct data entry, or DDE. This is a service that is only available to providers who submit claims using the Fiscal Intermediary Standard System, called FIS. This system processes claims that are submitted on a UB04 or an 837I. So we commonly refer to this as Part A claims. Now, timely filing does come up a lot when we're dealing with MSP claims, so I do want to make sure to touch on this. Timely filing requirements for Medicare claims is 12 months or 1 calendar year from the date the services were received. Generally, the start date for determining the 12-month period would be the from date on the claim. Now, there are times when the from and through dates on those claims may not be the same. So for claims billed on a UB04 or an 837I, this can occur when there's an inpatient stay, or perhaps when billing monthly for repetitive services. In those cases, facilities are going to want to use the through date on the claim to calculate that 12-month period. Claims containing span dates can also occur for services that are billed on a CMS 1500 or an 837P. Examples can include a physician who's providing oversight for an ESRD patient, or claims for DME supplies and rentals. So in this situation, the from date on the claim would be used when determining timely filing. You also have instances where a patient receives services on February 29th. So if that happens, then the claim should be filed by February 28th of the following year. Now, CMS has provided specific circumstances in which they will waive timely filing deadlines. Not billing Medicare because the patient had another primary insurance is not considered good cause for waiving timely filing in CMS's eyes. I held a timely filing webinar earlier this month, and I always hear of situations where a provider billed the primary insurer, but they never sent the claim to Medicare to process as secondary. And then, sometime after that timely filing deadline has passed, then the primary insurance recoups their money, saying that they shouldn't have been the primary payer. Now, if we had been billed as secondary, that claim would be in our system and we could make changes to process the service as the primary player. But if the claim isn't in our system, you're going to receive a timely filing rejection and that doesn't have any appeal rights. You also cannot bill the beneficiary except for deductible or coinsurance in the amount that would have been due had Medicare made a payment. Now, if you have billed the primary insurance and you haven't gotten a response and it's getting close to that timely filing deadline, you do have a couple of options. You can bill Medicare and allow the claim to reject. That way, the claim is in the system and it can be updated once you receive a response from the primary payer. Or you can file a conditional payment. And this occurs when you've billed the primary insurance and it's been 120 days and you haven't gotten a response. In these cases, Medicare may process the claim as primary, but they will need to be repaid once that primary insurance makes their decision. Now, next, we want to take a look at the contractors that are involved in MSP processing. First, we have the Medicare Administrative Contractor, or MAC. WPS processes claims for Iowa, Kansas, Missouri, Nebraska, and the national contract under our J5 jurisdiction. Indiana and Michigan claims are processed under our J8 jurisdiction. Now, our job is to process the claim based on what the primary insurance paid and determine if we are going to make an additional payment. We do not keep MSP records updated. We do not have access to those records. That is the job of the Benefits Coordinator and Recovery Center. They handle any activities related to collection, management, and reporting. So if a beneficiary tells you that they no longer have a certain insurance, or if you come across some information showing that entitlement dates are incorrect, those situations will all need to go to the BCRC. Then they handle updating the records. They also handle the recovery of mistaken payments that should have been processed by a liability, no fault, or workers' compensation plan. Any payment recovery that's related to group health plans, that is going to be handled by the Commercial Repayment Center. So this is going to include working age, disability, or those ESRD plans. Now, I will say that knowing where to find information when you're dealing with Medicare is always important. I've worked in Medicare for 25 years and I still find myself saying, well, we used to do it this way, but let me check and make sure that's still correct. We have to remember that we're dealing with a program that's run by the federal government. So there's going to be laws and regulations that pass and they can change the way that we process claims. I am going to leave the PowerPoint. So um, we can look at some resources and I can provide some guidance with the different aspects of MSP. Tom, can you verify that you can see the CMS website?
Yeah, Karen, I can see it perfectly and I can still hear you perfectly.
Great, thank you so much. Okay, so first we're going to start out with the internet-only manuals. Um, These provide guidelines on daily operation instructions, policies, and procedures. In the presentation, you will find a direct link to these resources, but I'd like to show you how to navigate because the direct links may not always be available. So for the internet-only manuals, we're going to start out by selecting Medicare. We'll go down to regulations and guidance, and then over to manuals. Um, right here, we have the internet only manuals. So I'll select that. Um, you can see there really is just a wide variety of regulations that they have here for Medicare. Um, of course, with this, we're centered on MSP today, so I don't want to take a lot of time covering these, but it really does, like the claims processing manual tells us how to process claims. The Medicare contractor beneficiary and provider communications manual actually has rules for how the provider outreach and education department and customer service have to respond to providers. So there really is a lot of information out there, but we are going to go to publication 100-5, which is the Medicare Secondary Payer Manual. Um, the chapters are going to start with an overview, which has quite a few options. If we go here and take a look, let's go back to the top here. So everything that you see here in red has all been updated. So they have made a ton of updates to this particular chapter in the manual. Here you can find definitions and terms that get used when dealing with MSP. It also covers the different types of plans, and it provides you with a summary of the rules pertaining to those plans. Um, so that could be something that's really helpful if you're just trying to get the basics down and learn those. If we go back to the table of contents, there are some chapters that might not make sense to you now, but they could be helpful later down the road. So things like Eckers, that's like a database for MSP. Um, there are the different like it has the coordination of benefit requirements. So there is a lot of information out here, but it does start with just that general MSP overview to give you some basics to help you out with that. Chapter 2, the MSP provision, that talks a lot about rules and regulations for the different plans. It goes into billing, so things that'll be covered later in this MSP series. Okay, so next we want to go to the coordination and benefits recovery. They have their own drop-down box. So if we go back to the Medicare header, and I'll go down to coordination of benefits and recovery, and I'm just going to start with the overview. So I think of the coordination of benefits and recovery contractor as the record keeper. They keep track of the other insurance coverage for all Medicare beneficiaries. And if we think about it, we really do need just one central place that manages all that information. A long time ago, Max had the ability to update a beneficiary's MSP information. So as you can imagine, things could get pretty messy. WPS could have a provider report that the beneficiary no longer had coverage for a particular plan. So we'd try updating their MSP record to say that the plan had terminated, but then, another MAC gets a claim to process and they're saying that they received a primary payment, so the insurance is still valid. There's just a lot of things that could go wrong when everybody had their hands in it. So now everything is reported through the BCRC. That way, all MACs have the same information. We all should be processing the claims the same way. So that's a big improvement. If we look at the box on the left, you can find links to additional information. Medicare Secondary Payer will provide you with some common situations on whether Medicare should be primary or secondary. So if you take a look at that, it has the common situations. It tells you Medicare pays secondary, kind of describes them. Um, I'm trying not to scroll too quickly in case it bothers anyone. It has responsibilities of beneficiaries under MSP. It has providers' responsibilities, and it also has employers' responsibilities. Okay, let me go back up here. Coordination of benefits is going to explain that whole process. and how they do everything there. There's also pages you can see over here for group health plan recovery and non-group health plan recovery processes. If you go towards the bottom, there's a contacts page. So here you can find addresses, fax numbers, things like that of who to contact. It does, I will say up here, it does state that if you do the recovery portals, those are a lot easier to manage cases. But you know, there may be some situations where you just can't use that portal and you need to get in contact with somebody. So this is where you would find all of that information. Now, our next resource comes from the Medicare Learning Network, and I always promote the Medicare Learning Network when I can because I find that CMS takes the information from their regulations, um, and they take what you really need to know and they put it in terms that are easier to understand. So to access this resource, we're going to go to the training and education. We'll go to the Medicare Learning Network. I always click on resources and training. And then I go to publications and multimedia. So you can see here, there's a lot of publications that they have out there. Since we're doing MSP, I'm going to check for Medicare Secondary Payer. And we get two resources that come up. That bottom resource, Medicare Secondary Payer, Don't Deny Services and Bill Correctly, is something that we will look at in later sessions when we cover billing. Today, we want to look at the Medicare Secondary Payer. You can see this is a booklet. If you are familiar with Medicare, or I'm sorry, with the Medicare Learning Network products, whenever you look at something that they have published, there's always this section where they tell you what has changed. Um, so that can be really helpful. Like if you, as I was saying earlier, if I was like, we used to do something this way, but it might have changed. This is going to tell me right away if it has. I still have to do research to see that, but it's just nice that it tells you what's been updated. There's also a statement that it tells you that essential content changes are in dark red. I do want to take you guys specifically to page 4, and this is just one of the reasons why I think this particular resource is so great. Um, Here, CMS has provided a table of common MSP scenarios. It tells you who pays first, who pays secondary. I just find it easy to read. It covers, as you can see, you got group health plans. It has the federal Black Lung program, um, COBRA insurance, Medicare Advantage. It covers the different workers' comp, accidents related. So it's really just a one-shop spot where you can get information. If you want to look up something quickly and say, this is the scenario, who am I supposed to send this to? This is a really great resource that I think can help with that. And I think it makes things, you know, easier to read than trying to comb through a manual. Now, I also want to take you to the WPS website. We do have some resources to help you with MSP questions. Now, the PowerPoint slide contains two pictures, and that's because the resources available are slightly different depending on your jurisdiction. From the WPS homepage, you're going to go to the Topic Center, and then you'll choose Claims. I'm currently in J5 Mac Part B. So if I scroll down, we have all the topics listed. If I scroll down to Medicare Secondary Payer, I can click on this little drop-down box, and it's going to show me that there's 3 resources available. We have the BCRC, an MSP fact sheet, and an MSP questionnaire. Now, if I go up and I change my jurisdiction to Part A, and I go back down to MSP, we have that BCRC and we have the questionnaire, but instead of the fact sheet, we have a billing procedures resource. So that's why I said, you just want to make sure that you're in the right jurisdiction when you're looking at those things. So for Part A, when you see these Part A jurisdiction, that's going to pertain to claims that are processed through FIS. So claims submitted on a UBO4 or an 837I. If you choose jurisdiction Part B, that's going to refer to claims that are processed through the MCS system. So a CMS 1500 or an 837P. We have had times where providers, like they think in terms of services provided. So even though they're a hospital, if it was an outpatient service, they think Part B. But this is actually the processing systems that the claims went through. So you'll just want to think of it in those terms when you're making sure you're in the correct jurisdiction. Now, the last two resources are going to be for patients. Um, I don't have this open, so let me go to this real quick. So Medicare.gov is a resource that is geared towards beneficiaries. It gives them information on enrollment. It helps them find supplemental plans and providers, as well as a way to pay online premiums. So they have all these services available to them on this website. We're going to look at a publication on how Medicare works with other insurances. So I'm going to go to Basics. I'm going to go to Forms, Publication, and Mailings. And then for the category, I'm going to select Coverage and Payment. So there's a lot of resources out there for beneficiaries, but we are going to look at this, how Medicare works with other insurance. Now here, CMS kind of breaks down the different types of insurance plans. Get that bigger in case nobody can see it. And I wanted to provide this resource today because you could get in a situation with a patient who has another insurance and maybe they have a hard time understanding Medicare's rules. I think we can all admit that sometimes it's difficult for us to read the regulations and determine what we're supposed to do. So this tool is something that you can suggest to a patient who might be struggling with which insurance they're supposed to pay for which services, but it does go into the second section of how it works with other coverage. So, I just wanted to provide that in case you do get in a situation where you are dealing with a patient who just doesn't understand what's supposed to be done. This could be something to help them. Okay, I am going to go back to the PowerPoint now. Give me one moment. So here's all the direct links for those resources that we just went through, but I did want to show you the navigation just in case. Before I go any further, I do want to check in with Tom. I had mentioned that if you have something about clarification in the chat, Tom was going to help you with that. But I want to ask Tom, is there anything that's come through in the chat that could benefit everybody that's in attendance today?
We actually do have just a couple questions in the chat, and they're really related to the MSP questionnaire or the MSP questions. So the first one is asking, they have an electronic questionnaire which they use versus paper. Is that acceptable from CMS?
Uh, we don't take we don't get copies of the MSP questionnaire. And I apologize. I did say that I was going to show that when I was out there. So that's more of a tool for you to help like where things are going to go. Tom, I don't know if you have, you've done a lot of MSP education too. I don't know if you have something that you want to add to that.
CMS does not dictate the method that you use.
So if you use paper, awesome, amazing, right? Scan it in, good, good, we're good. CMS doesn't dictate that you can't use an electronic method. What CMS does state is that you have to have it dated. You don't have to have it signed, but it has to be dated. So yeah, electronically, great. Paper, great. Scan it in, great. It doesn't. They don't have any of that in there, so you can use whatever you want.
So this in the Medicare manual, chapter 3, it's section 20.2.1. They have model admission questions. So these are questions that it kind of, as I said, it kind of goes through like black lung. Do you have it? If you do have it, when was the injury? Workers' comp, it asks questions. So you can see where it kind of says if yes, and it makes them provide you with more information. So again, you can take this information. Sorry about that. You can take this information and use it the way you'd like to use it. But like Tom said, it does have to be dated so that that helps out with coordination of benefits, things like that. I'm sorry, Tom. Anything else that came through?
There's one other question, but it's still related to this. They are having the patient electronically verify the information they have in their system. So the patient, I'm going to just assume a little bit, just to let everybody in. They have the patient maybe come up to their registration, and then as part of that, they display electronically the primary payer information that they have. They're wondering if that is still okay to do.
Tom, I'm sorry. Could you repeat that? I was having a hard time following it. So they have electronic like
Yeah,
check-in?
so they have an electronic check-in, and during that process, one of the items that displays is the primary payer information, the other insurance information. Is it okay just to have the patient verify that information and go on?
It, yes, and that is one thing too, is that you do want to keep checking with them. You do want to keep having them verify that. So even after they've filled out that initial MSP questionnaire, you do want to periodically check back with them and have them verify it. So it's great that you have something like that keeps those up. Tom, I don't know if you have anything to add to that.
Nope, I mean, that's it, exactly it. You need to do it, figure out how you wanna do it, so yeah, there you go.
Great. Okay.
Um,
Well, if there's, oh, go ahead.
the last question we're gonna save, just but it is about, like, again, or not save. The last question we're gonna take is, a questionnaire for a non-face-to-face encounter, such as cardiac and, interrogation services. There's also a variety of people ask me about telehealth, so I'm kinda summarizing all of this and shoving it into one big question. Um, so basically, it's a non-face-to-face service. You still have to have the questionnaire.
You would still want to obtain that information so that you can make sure that you're billing correctly.
Yeah, and to kind of further along, it doesn't have to be a written questionnaire. It could be a set of questions that you ask. So if you're not seeing them face to face, as long as you're talking to the patient, you need it. So the example would be a reference lab that never sees this patient. They're going to rely on whoever drew the blood draw, whoever sent them that lab. Well, they don't have patient contact. They're the ones that would be exempt from it. There's no contact, not just not face-to-face contact, but no contact. They're an exception, but they still have to determine. Now, their determination can come from whoever sent them that lab. So I'm hoping that all makes sense there. And Karen, that does bring us to what we have for questions for this time.
Great. Thank you so much. We will go ahead and move on here. Now, when you disconnect from the webinar, you are going to be redirected to a CMS survey. I'm also going to have Tom add a link in the chat. I really do hope that you'll take a moment to provide feedback on how I did today. Like I said, this is something new that Tom and I are trying. We're going to do this whole series, and we're really hoping that by taking just that part 2 time to really answer your questions, that you can get the information that you want. Um, I know we haven't had part 2 yet, but if you like the idea, let us know. If there's a way you think we can do it differently, let us know that too. The redirect is going to look like what you see over here on the right. So this right here, the little triangle, and we just want you to know we don't have control over how this looks. Um, so it's not spam, it's not anything malicious, but it can, when you X out of the webinar and all of a sudden you get this pop up with, this symbol, you could be like, what is this? But that is the CMS survey. We have taken feedback that we've gotten from our surveys, and they do lead to change. We've added chapters to our encore presentations. We've put training indicators in our webinar descriptions. And we've also held Medicare Education Expos based on topics that people said that they wanted for future education. So you can see your opinion really does matter, and we really do care what you think. Now, after disconnecting today, you are going to receive a thank you for attending email, and that's going to contain contact hours that can be submitted for continuing education units. If you joined only by phone, WebEx cannot generate this email, so you will need to contact us. In the chat, Tom's going to add a link to the education mailbox and what information is needed for us to send a certificate to you. We do hope that you will join us for part 2 of this session that is scheduled for August 5th from noon to 1 Central Time. You can register for that on our live events page. And then if you do have questions that were a little bit more than just clarification, be sure to email those to us. That does bring us to the end of today's presentation. On behalf of myself, Tom, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.